Good morning, good afternoon, good evening to all of you who've joined this webinar. Thank you very much for being here. This is a South Center webinar on strengthening antimicrobial stewardship, policy insights from the COVID-19 and future pandemic preparedness. Now, this webinar comes at a very timely time, of course, because of the subject itself, but also because we are at the moment where the negotiators at the World Health Organization are also about to conclude an agreement on pandemic preparedness, prevention, and response. And this agreement has an element related to antimicrobial stewardship, which states that member states have agreed that they will be taking measures to address all the emergence and the spread of pathogens that are resistant to antimicrobial agents. And they also elaborate that this should include facilitating affordable and equitable access to antimicrobials and to promote appropriate, prudent, and responsible use of antimicrobials. So in this context, this will be very timely to help us inform policymakers as well as researchers, experts, and others how we can move together in facilitating the implementation of these and existing obligations and overall to have an impact on addressing the crisis of antimicrobial resistance. So we will start this presentation with Dr. Rasha Abdesalam, who is a consultant and AMR with the South Center and also director of the Antimicrobial Stewardship School, FADIC, in the United Kingdom. And she will be explaining to us her latest policy brief that she did for the South Center, specifically on this topic. And then this will be followed by a panel with our distinguished guests, Dr. Nusrat Safik and Dr. Kamini Walia. So I pass on to you, Dr. Rasha. Thank you.
Hello, everyone. I hope you can hear me clearly. I couldn't make presentation.
You should be able to share.
No, it's not. Let me check again. Yes. Yes, I find it. Can you see my screen now?
Yes, we can. Thank you.
That's great. Yeah, now we can start. Hello, everyone, and I'm very happy to be with you today in this presentation for this webinar, which is very, very important at this moment to ensure the emergency preparedness and know what are the lessons from the COVID-19 pandemic and what is the impact of the COVID on antimicrobial stewardship, and ensure to take the key recommendations or call to action to fight the antimicrobial resistance and ensure the proper use of antibiotic. My name is Dr. Rasha Abdesalam Shinnawi, and I'm very delighted to be with you today to start our presentation about the policy brief, which I was very, very delighted to prepare with South Center regarding the lessons from the COVID pandemic. The objectives of my presentation today is to explain three important issues. The first one is to discuss the recent policy brief from the South Center about the impact of the COVID-19 on antimicrobial stewardship and antibiotic resistance. The second part is to highlight the key lessons learned from the COVID-19 pandemic. And the third part is to propose policy recommendation to strengthen antimicrobial stewardship and address the global threat of antimicrobial resistance. So let's start our presentation today with the policy brief link in the South Center. Here in the South Center policy brief link, you can find this. I put the link here, and also by the end of presentation, you can download the presentation. You can download the policy brief, which include all of details we will discuss today and in depth and in more detail. The first part of my session today is about the impact of the COVID-19 on antimicrobial stewardship. First of all, we need to identify the problem. What is the problem of antimicrobial resistance and why it is important to learn about the antibiotic stewardship? The global report on antimicrobial resistance, which is expected that 10 million people is expected to die on 2050 due to the antimicrobial resistance, which we find here spread all over the countries of the world. And this is the main problem. When we find patient and we know that the patient has infected, but unfortunately this infection or this bacteria is resistant, and we could not find any antibiotic reserve to treat this bacteria. And this is the main cause of antibiotic resistance, which increase the mortality worldwide, particularly in the low and middle income countries. For this reason, there is a very urgent need to antibiotic stewardship, to learn, to identify how we implement antibiotic stewardship and understand the role of antibiotic stewardship in antibiotic resistance. Now I will go from this problem of antimicrobial resistance, which could cause 10 million people to die in 2050, to understand or to go more in depth in antibiotic resistance, which is due to unregulated antibiotic use or irrational use of antibiotics, weak infection prevention and control, limited access to diagnostics in low and middle income countries, inadequate antibiotic stewardship practice. For this reason, we are calling in our policy brief to understand how to properly implement antibiotic stewardship. We have two pandemics. We see this problem in 2019 when we have two pandemics, the COVID-19 and the antimicrobial resistance. And unfortunately, COVID-19 was very, very, very global pandemic, which caused more than 6 or 7 million people died worldwide. I was tracking the numbers because my research is on antibiotic stewardship and the COVID. So when I was tracing the numbers all over the years, I found this number is significantly increased in 2019, 2020, 2021. So it's global and pandemic problem. And with the issue of antibiotic resistance and disturbing and dilemma in the healthcare systems, which affecting the prescriber decision regarding or choice of the proper antibiotic, from here the resistance started. We find 35 to 75% of the hospitalized COVID-19 patients receiving antibiotics, despite the low bacterial co-infection rates. And there is a very rise in the multi-drug resistant organism. I know there is a dilemma regarding the prescribing, and my research was focusing on this. But understanding the main issue for the patient and the understanding when we use the antibiotic effectively, this is the main part of antibiotic stewardship. So the COVID-19 affecting the antibiotic stewardship practices in the hospitals and make disruption in antibiotic stewardship program, because to apply the antibiotic stewardship as a hospital-wide or as a program-wide all over the hospital or healthcare setting or community settings, we need to have a structured program. And due to the pandemic or the COVID-19 disrupted all of the activities, including the audit, the antibiotic review activities, the educational activities also. Additionally, there is antibiotic stewardship fatigue among the prescriber, because with the dilemma of if the patient has viral infection, if the patient has COVID, I see it on the practice when I was practicing that the patient coming to the hospital with a lot of disturbance and dilemma regarding the antibiotic prescribing. For this reason, the COVID-19 had significant impact on antimicrobial stewardship. Another impact from the COVID-19, which is infection prevention and control. By overwhelming hospitals, this led to the like a retard or disruption or a challenge in infection prevention and control. Additionally, there is a very significant increase in the healthcare associated infections, which are affecting the antibiotic resistant, unfortunately. So we have the time in 2020 and the 2021, we have problem of dual pandemic or double pandemic. One due to the COVID-19 pandemic, which is significantly affecting our healthcare system. And the second one is the antimicrobial resistance. For this reason, there is a very, very urgent need to understand, to learn from this experience, from this practice, listening to the community, to the global views, to the statistics, to the healthcare from the clinical practice and the healthcare settings, and to learn from this experience and take the lessons and ensure enough preparedness for any future pandemic. And also, it is important to promote the role of the AMR surveillance, because surveillance is very important to provide data or monitoring or measuring the antibiotic use and antibiotic resistance, and be able to use targeted action in order to prevent the antimicrobial resistance. Targeted action could be targeted stewardship practice, modified according to the practice, targeted educational program, targeted public health and the global initiatives, and this will help to mitigate the antimicrobial resistance. And one of the most important core issues is sustainable and resilient antimicrobial stewardship practice. This is very important because healthcare setting environment is a changing days and days. And what we see in the COVID-19 pandemic with the change in the healthcare setting require to be prepared to have antimicrobial stewardship program sustainable with the minimum implementation in order to be able to maintain the rational and judicious use of antibiotics. First of all, you need also to discuss the definition of antimicrobial stewardship as a quick revision, because we will repeat this all over our sessions today. Antimicrobial stewardship is the organizational approach in order to promote the judicious use of antibiotics. Organizational or structured approach on the healthcare professionals. It's like a systematic approach to maintain the judicious and right use of antibiotics. And finally, it is important to understand the One Health approach, which is critical to tackling the antimicrobial resistance. The second part of my presentation today is about the lessons. What lessons we have learned from the COVID-19 pandemic to strengthen the antimicrobial stewardship? The first lesson is to embed the antimicrobial stewardship into pandemic response plan to strengthen the framework of the framework to prevent the antibiotic misuse. We need to integrate antimicrobial stewardship into national and the global pandemic plan and enhance real-time and right-time surveillance in order to track the antibiotic use and resistance. And we need to invest on antimicrobial stewardship training, either general training or targeted training according to each specialty and each profession, and ensure equitable access to antibiotics. And not equitable access only. We need to educate the health professionals and the prescribers and all the healthcare workers how to promote the antibiotic stewardship in order to reserve the antibiotic or the broad spectrum antibiotic to the patients who require it, and reserve antibiotic and our resources globally. So this is the first important lesson, is to embed antibiotic into our plan. The second one is to strengthen the AMR surveillance. We need to work more in the surveillance, data gap. We need to provide the tracking or the way to monitor and measure the antibiotic use and the antibiotic resistance, because this will help to maintain any changes for antibiotic stewardship, to maintain the resilience and sustainable antibiotic stewardship practice. The second one is using technology. Now with AI, we can have a lot of activities. We can use the digital dashboard, such as the WHO Glass report, interactive dashboard, automated reporting and surveillance. And also strengthen the international collaboration, such as the WHO AMR surveillance, which is called Glass report, to improve the AMR response. So this is the second lesson from the pandemic, to maintain the AMR surveillance in order to promote the measuring and the tracking and fill the data gap to take the targeted action toward the antibiotic resistance and maintain sustainable antimicrobial stewardship practice. The third lesson is diagnostic. We go to surveillance. Now for diagnostic, we need to see there is each healthcare setting, it should be among all the globe, each hospital has what's called antibiogram. This is a cumulative report to make monitoring of the bacteria resistance and see the pattern of the bacteria resistance. And this will affecting the antibiotic prescribing decision. So we need to promote this. We need to invest in diagnostic tests in order to improve infection differentiation and reduce the antibiotic misuse. We need to expand the point of care testing to make faster identification between viral and bacterial infection. And again, the antibiogram is very important because it helps in the clinical decision making and the antibiotic stewardship guideline and the antibiotics selection. Lesson number 4 is to rationalize the antibiotic use. This is very important. We use antibiotics. We need to be adhere to the evidence-based guidelines and enhance and optimize the antibiotic prescribing as per guideline. This is very important because each hospital also has antimicrobial guidelines. These antibiotic guidelines need to be updated with regard to the antibiogram results, with the infection prevention and the control and the AMR surveillance and the resistance pattern in the healthcare settings. And we also educating the prescriber how to adhere to the antibiotic guideline. This is very, very important. The second part is public education. We need to raise this to the public awareness in order to engage the public. I have practical experience when I was speaking with the public about the antibiotic misuse, convincing them that antibiotic is not the solution for everything. Antibiotic is not used for viral infection, not sharing antibiotics with families, make them part of the education, teach them, educate them how to properly use the antibiotic as prescribed with the appropriate duration, appropriate course of antibiotic. It's very important to keep the public engagement and involvement in the antibiotic stewardship practice. And the third one is to ensure continuous training for the healthcare professionals about the trends and stewardship practice, provide updated prescribing tools, like I mentioned in the resistant data, surveillance data, and the antibiogram, and finally promote equitable access to the medicine. This is very important to rationalize the antibiotic use. Lesson number 5, which is One Health approach. All of healthcare sectors with veterinary, with environment is very important. The hospital disposal, the animal, in the vet, antibiotic use in vet, all of this complementary because all of this affecting One Health approach. It's very important to strengthen this collaboration, to implement a policy on antibiotic use in agriculture because it's affecting the antibiotic resistance and also affecting the antibiotic use, improving data sharing and regulation on any pharmaceutical waste management, invest in One Health infrastructure, and again, ensure equitable distribution of antimicrobial stewardship resources in the low and the limited income countries. This is lesson number 5. So to summarize the lessons or key lessons from the COVID-19 pandemic, we have 5 important lessons, starting from lesson number 1, which is equitable antibiotic stewardship into local action plan. The second one is to enhance the AMR surveillance and collaboration. The third one is to enhance diagnostic infrastructure. Number 4, rationalize or using the rational use of antibiotic. 5 is One Health approach, maintain One Health approach. These 5 important lessons are really learned from the pandemic. I see it from my practice when I was seeing the patient and see how we prescribe the patient in the ward setting in the hospital and making my research, 5-year researches on antibiotic stewardship and the COVID-19. It is very important to have or take lessons from this pandemic in order to ensure the emergency preparedness. The last part in my presentation today, which is call to action and recommendation. We need to understand the key important call to action or recommendations based on these lessons from pandemic, based on understanding the impact of pandemic on antimicrobial stewardship. We need to be prepared. The first lesson is addressing sustainable access of antibiotics. We need to maintain in low-income countries and limited resource countries sustainable access of antibiotics to strengthen supply chain and maintain resilience for antibiotic and diagnostics. Prevent over-the-counter antibiotic use, which is need to be strictly regulatory framework to restrict the antibiotic, to help to ensure and reserve the broad spectrum antibiotic to the patient who really need this antibiotic. So it's important to address sustainable access to the antibiotics. The second one is to strengthen the antimicrobial stewardship practice in global health policy. This is very important. Important to ensure antimicrobial stewardship integration into the universal health coverage, scale up the antibiotic stewardship education. Believe me, with the experience, with follow-up and maintain education, antimicrobial stewardship education for the healthcare professionals, for the prescribers, and even to the public, it helps to understand how we make a criteria or a checklist or how to systematically think prior to use antibiotics. This is very important. And what is I find, because I have more than 10 years experience in antibiotic stewardship, that each healthcare professional need to learn according to the level of practice. This is very important. And also antimicrobial stewardship education need to be in a general for the health professionals and need to be targeted with the resistant trim. And this is the rule of the antibiogram and data surveillance to raise the education regarding the resistant pattern. So we need to make general education for the health professional. And like we see in the COVID-19 pandemic, we need to maintain the resilience and sustainable practice of antibiotic stewardship through training and education. Also enhance surveillance and diagnostic. Without data, we could not read. We know what's called the old quote about we could not manage what we could not measure. So if we don't have data to measure the antibiotic resistance, antibiotic use and consumption, we would not be able to take the right actions towards the antibiotic resistance. So it is important to enhance surveillance and diagnostic and expanding the digital use, because now with AI, digital technology, we can use this data on a broad and a global range. And we can use real-time data monitoring in order to keep monitoring any trends, identifying any trends, any pattern before it become global or it become a pandemic. Then enforcing the regulatory measures to implement strict guidelines for the antibiotic use and strengthen governance on antimicrobial waste disposal, and also promote education. Education and awareness is very, very important to launch a global antibiotic awareness campaign. And I'm very delighted to the World Antibiotic Awareness Week of the WHO, but it's important to keep up educating, not only 1 week. It's need to be a regular campaign to raise antimicrobial resistance awareness and integrate antimicrobial stewardship training into medical and pharmacy and nurse and all healthcare practice education, public health and decision making, and for the public and engaging. Also, the last part is advancing research and development. It's very important to work on research, to invest into new antibiotic therapies, and alternative treatment is very, very important. To leverage the digital tool to improve antimicrobial resistance data collection and analysis. So to summarize the key recommendations or policy recommendation from the policy brief about the lessons from the COVID-19 pandemic, here the 6 important recommendations. Addressing sustainable access challenge, it's advancing sustainable antimicrobial stewardship, enhance antimicrobial resistance and surveillance and surveillance, AMR surveillance and diagnostics, enforcing regulatory measures, promote education and awareness, and finally, advancing health research and development. These are very important key call to action or key recommendations from our policy brief. Finally, to conclude, COVID-19 exposed a very critical gap in antimicrobial stewardship and AMR surveillance. We need urgent need in order to strengthen antimicrobial stewardship and ensure strengthen the role of antibiotic stewardship into emergency preparedness, ensure equitable access to antimicrobial and diagnostics, implement One Health-driven MR strategies. Policymakers, healthcare leaders, and the global health organization must act in collaboration now to build the resilient antimicrobial stewardship framework or toolkit to prevent the next crisis or have an important role. We could not prevent, according to my reading, unfortunately, because I'm very expert and in depth in this. We could not prevent any pandemic from happening, but we need to ensure preparedness to be well prepared for any emergency or any pandemic and maintain the resilient and sustainable antimicrobial stewardship practice. This is the end of my presentation. I'm ending now with the reference to our policy brief. I highly recommend all of you to go and read it. It's downloaded from the South Center website. This is the details of the policy brief, and including the lessons, including the key recommendation we explained today. And here is the link of the policy brief, and they put it down, and here also the link of the policy brief. I highly recommend to read. And I'm very happy to receive any questions, any commentary regarding this policy brief in order to keep moving to strengthen the antimicrobial stewardship practice and ensure emergency preparedness. This is the end of my presentation today, and thank you very much for listening. And I'm very happy we have, I think, 5 minutes Q&A before we go to the panel discussion after this with Dr. Kamini and Dr. Nusrat.
Thank you so much, Dr. Rasha. And you might want to note, participants, some of you have already started putting some questions in the Q&A section of the webinar. Depending on the time, we'll, of course, aim to answer those directly. If not, Dr. Rasha can also, with follow-up, continue to provide more detailed answers. So that will also include additional follow-up with a report of this session. Dr. Rasha, just to inform you that one of our panelists is having difficulties joining us now, but we are delighted that we do have Dr. Kamini with us from the Indian Council of Research, which will be providing us those excellent insights also to all of her extensive experience in the Indian context as well. So for the moment, we do have some questions in Q&A. Dr. Rasha, I don't know if you'd like to address any of them at this moment, or we can then continue after we have the panel discussion. Turn back to you.
We can continue after panel discussion. Okay.
Great. So let's then proceed with our second part of this webinar.
Now we have very important panel discussion with Dr. Kamini. Kamini Walia, this discussion is very important as a commentary for the policy brief and also to answer some questions. We have with us today Dr. Kamini Walia, is a senior scientist at the Indian Council of Medical Research, leading its antimicrobial resistance initiative. She specializes in AMR surveillance, antimicrobial stewardship, and One Health. With over 20 years of public health experience, she has led key projects in infectious disease and diagnostics. She previously served as a director of research and development at PATH, and was a WHO expert on essential diagnostics. Welcome, Dr. Kamini, and I'm very delighted to have you with us today in a panel discussion.
Thank you, Rasha. Thanks for a very enlightening presentation on the policy brief.
Thank you. Now we have the first question, is a commentary on the policy brief. What are the key antimicrobial stewardship lessons learned from the COVID-19 pandemic?
Well, COVID is still very fresh in our memories, and COVID did lead to deprioritization of antimicrobial stewardship, and many studies and many published documents have actually documented this, that it led to deprioritization of antimicrobial stewardship. And India also, we saw that in the hospitals where we were actually working, we saw that the COVID led to uh, it brought in a setback to all the activities related to antimicrobial stewardship which were going on in these hospitals. So ICMR has a network of around 25 hospitals where we implement antimicrobial stewardship program, and this we had initiated actually pre-COVID. We decided to put together antimicrobial stewardship committees in each hospitals. They were asked to implement interventions like prescription audit, feedback, formulary restrictions, and many other activities related to antimicrobial stewardship. What we saw during this time was that 78% hospitals reported non availability of antimicrobial stewardship staff. They were assigned to other activities, and they were assigned to other roles and duties. So there was significant understaffing in terms of the availability of staff to undertake the activities of antimicrobial stewardship. Besides that, there were less resources to time to undertake the antimicrobial stewardship meetings. There was setback to the prescription audit and feedback reported by more than 50% of the hospitals. Uh, Also, recording data was a challenge. As you know, that there was a restriction on entering to the hospital. So all these initiatives, they actually compromised even the ongoing antimicrobial stewardship program. So all these led us to think, what lessons can we draw from this? So I think the first lesson is putting the processes and frameworks in place. You cannot think of building the processes and frameworks for antimicrobial stewardship during the pandemic, while the pandemic is going on, because your priorities are going to be different. But if you invest in these processes and frameworks, now, and make it a part of your UHC or your routine healthcare system, these systems will actually help you even at the time of a pandemic, whatever is the pathogen, whatever is the bug. This is the most important, I think, investing in these resources in creating these frameworks. And where is this going to happen from? We are going to need funds, and those funds will become available only if there is a governance at the top level. That's what I think was the biggest lesson, that the countries where the governance and the leadership at the top level took control, they were interested in handling the pandemic. It made immense difference in how those countries responded to the pandemic, and that's what antimicrobial stewardship can also benefit from. The other
Yes.
very important lesson, I think, which was there from COVID was that diagnostic capacity of the country was very important. I mean, how quickly we were able to put our labs into the system, how quickly we were able to introduce the point of care tests, all that helped. So that's why strengthening of the labs, which again require resources, becomes very, very important. Because without these labs, without diagnostic stewardship, we cannot think of practicing antimicrobial stewardship. So investment in labs is very, very important. The other most important lesson, which you also highlighted, was the importance of digitalization. How quickly the data was made available. I mean, I think almost all countries were beyond a point. I mean, initially there was a lot of confusion, but beyond a point, all countries were were actually monitoring their data in the real time, and they were trying to introduce the interventions, trying to take the necessary actions based on what the real time data reporting was. And in antimicrobial stewardship, we may not have the real time data sometimes, but at least having labs which bring out the annual data or 6 monthly antibiograms, that is something that we need. So there are many lessons. I will stop here for a while. There are many lessons, but I think these were some of the overarching lessons that we learned from COVID pandemic, and which our uh, antimicrobial stewardship program can benefit from.
Yeah. Thank you very much. Very, very important lesson. The second question is, what action should government need to prioritize or make prioritization to strengthen the antimicrobial stewardship?
I did allude to some of it in my previous reply as well, but I think the role of the government is very, very important. And one thing which I would like to mention here is, which is the most important and which we all know, that which needs to be prioritized, is funding of national action plans. So many countries, they have had national action plans, including India, which have only had suboptimal success in terms of, I mean, every department has been doing their role, but if you ask me, very few countries have been able to launch a coordinated response for towards the implementation of the national action plans. And one of the biggest hurdles on that has been that there has been limited ownership from the government, because any national action plan is not just confined to the Ministry of Health. It requires multiple ministries to come together. Pharmaceuticals, it requires water and sanitation and hygiene, it requires animal sector and the livestock, multiple ministries. For example, in India, we have, I think, 11 to or 13 ministries which are, kind of a co-signee on a national action plan. So, having this kind of a coordination, I mean, all these ministries are not going to report to Ministry of Health. I mean, this is something that every country deals with, this internal situations. So that's why the role of the government becomes very, very important. The countries where the national action plan implementation was monitored at the level of the prime minister or such levels, it led to better implementation. For example, Thailand. It is a case study by itself how the country implemented its national action plan. So that's why the role of government becomes very important, because when the government takes ownership, it makes sure the national action plans are funded. It will make sure the human resources that are so scarce and so limited for implementation of activities like antimicrobial stewardship, where you need ID physicians, where you need pharmacists, where you need nurses, where you need microbiologists, where you need established labs which report quality data. It is not going to just come like that. It is going to require a plan. It is going to require a suitable amount of funding. And also, I think if the government prioritizes to strengthen antimicrobial stewardship, um, there will be a
Yes.
mechanism where all the data which is being generated in the country is utilized to guide the actions and the implementation of national action plans, so that we have there is a mechanism that we are able to utilize this data. Right now, so many labs in so many countries are generating this data, which is not being utilized because we are not able to collate that data. We are sometimes the quality is compromised. So, with all these things, I think it is important that we have ownership at the highest level. It is the national action plans are governed by the government. Antimicrobial stewardship is one of the pillars in all national action plans. I think it is the third or the fourth pillar in every national action plan, which is optimizing the use of antimicrobials both in the human and the animal sector. So we do not need anything new. It is already part of national action plans. Every country has a national action plan. It is just that we need to implement it well.
Thank you very much. Thank you very much for your, yeah, you say everything. The question number 3, what strategies can be implemented to sustain the antimicrobial stewardship efforts in low and middle income countries?
So, starting antimicrobial stewardship in low middle income countries is always a challenge. And I think I saw a question in chat where somebody has asked that what about the countries which do not have antimicrobial stewardship in place? How can they start? Believe me, we were in the same place few years back. Very few hospitals were doing it, and there was very limited expertise to undertake antimicrobial stewardship in the hospitals. And we also started it from scratch completely. Um, it is important that first there is willingness to do it. It may not come from the government, but few hospitals can come together and form a network, and they can decide that okay, we are going to implement antimicrobial stewardship, and they would need to convince their leadership to provide those resources, to provide support, provide that human resource which they need to implement that antimicrobial stewardship. And you will definitely find some resources within your hospital to take that first step. So once you take that first step, I think you will be able to demonstrate how effective it is. It is not going to come very quickly. It is going to take a while because antibiotics level don't come down, prescriptions don't come down very quickly, and the MDR rates also don't come down very quickly. So it takes some time for all these efforts to start showing. But I think I have seen that every hospital has a champion of antimicrobial stewardship, and that is a good starting point. Many hospitals in low middle income countries do not have ID physicians. So where do you get ID physicians to lead antimicrobial stewardship? You can start with a pediatrician or an intensivist or any physician who is passionate about antimicrobial stewardship and has training on antimicrobial stewardship. So that would be the first step that hospitals can start with. And then you can have the stepwise approach going forward. Initially you can monitor the process indicators, like does your hospital have antimicrobial stewardship committee? Are the committee members meeting regularly? Are the team meetings being held? Are they analyzing the AMR data or antimicrobial stewardship usage data? Then for first few years you can just do that and see how you are progressing. Following that, you can start monitoring the outcome indicators. For example, if you have been able to introduce formulary restriction, what kind of changes has it brought around? Have the prescriptions of that particular antibiotic come down? What is the response to prescription audit and feedback? Does the hospital have antibiotic policy, and do the physicians adhere to that? What are the de-escalation rates? So all these things can come later, but please try to create a process and framework which you can sustain, which your hospital will support to sustain. So these are some of the steps which I think are very important for hospitals in low middle income countries where there are resource constraints. We have also started this process similarly. Nusrat is not here today. I'm sure she would have had those experiences to share. And what I can share here is that the hospitals which were part of antimicrobial stewardship network during COVID, they followed the principles of COVID. They did not go beyond, one or two antibiotics which were being prescribed to the patient. They had very good practice of AMS despite the staff being taken away for other activities. And that was the data that we also published in when we published our experience on secondary infections in COVID patients. So basically, what I'm trying to say is that if we are trying to be prepared for the pandemic, that preparedness will not come during the pandemic. For that, we have to invest now and create the systems and frameworks which will help us sail through and which we should be able to sustain. The other very important point that I would like to highlight here is a public private partnership. Our whole program, we are a research body, so our intent was to create a model, antimicrobial stewardship model, which can be practiced in a country like India or any other resource constraint or LMIC setting. The kind of collaboration we have is that many private hospitals who were previously implementing antimicrobial stewardship are also part of our network, and they provided a lot of initial support. Also, many private institutions in many countries, they have better surveillance systems, they have better uh, networks or data management systems. So I think this kind of a more collaborative approach will be very helpful in sustaining the surveillance or the stewardship efforts in LMICs. Thank you.
Thank you, Dr. Kamini, for your comprehensive response. You say everything I was thinking. And it's very, very important to focus about the antibiotic stewardship and sustainable implementation of antimicrobial stewardship, starting from the Antimicrobial Stewardship Committee and going forward to the framework and the strategies for antibiotic stewardship, implementation, de-escalation, and formulary restriction, antibiogram, and all of these. With regard to Dr. Nusrat's question, unfortunately, she has a technical issue. She would not be able to be with us, but we will send her the questions. We take it out. Vivian. Okay, we will send the questions for Dr. Nusrat and take her responses, and we'll share her all these responses in the report that would be launched later on the South Center website. Just to conclude, this is the final closing question. I was aiming to make discussion on it with Dr. Kamini and Dr. Nusrat about the most critical takeaway from our discussion today for the policymaker and the healthcare leader. What would you want to say, Dr. Kamini? Yeah. Final takeaway.
Final takeaway is that the antimicrobial resistance threat is for real. It's not going anywhere. And antimicrobial stewardship is not a choice anymore for any country. It is a necessity. So please recognize this as a threat that is looming upon us, and also invest in creating systems and processes so that we are able to save antimicrobials for our future generations.
Yes, yes. Importantly, to maintain the sustainable and resilient implementation of antimicrobial stewardship and using the antibiotic stewardship smartly according to the different sector, because each sector of practice has a specific code of practice, and the antibiotic stewardship should be targeted to each sector in order to maintain the proper use of antibiotic from the prescribing till administering to the patient, diagnostic, infection control and the prevention, and then finally to the discharge patient to maintain the public engagement. Yeah, that's the main important lessons. So this is the end of our presentation today, and thank you very much all for listening. Now we have closing for our webinar. As I think it's Q&A.
Thank you, Rasha, and thank you, Kamini, for all your presentation and comments. We do have some questions on Q&A. I think I've been monitoring, and I think many of them have been addressed in the comments as you've gone along. But feel free if you'd like to either type some answer or address any of them in the few minutes we have left. I note one of the issues that was asked about was with regards to the linkage of antimicrobial stewardship with universal health coverage. And I do see that Dr. Kamini had addressed this in the sense of stating that there is a need to have a broader approach to antimicrobial stewardship, not only in the particular element of healthcare facilities, but also more broadly on government policy and regulation, as well as you Rasha, you mentioned that antimicrobial stewardship is important not just in the human health sector, but across different sectors. And the key element with UHC, of course, is the equitable and affordable access to antimicrobials, antibiotics, and others. And that is an essential element of universal health coverage, is how do we actually create the frameworks where we have the strong supply chains and we have the systems in place to have equitable, affordable, and access antimicrobials to everyone when they need them. And another element, of course, is the health workforce, which Dr. Kamini mentioned was this huge problem of understaffing, resource constraints during the COVID-19 pandemic. And of course, universal health coverage should be a pathway to ensure that we have essential health services for all with the adequate trained staff that can also give adequate guidance in terms of adequate antimicrobial use. So I'll just pass back for both of you if you'd like to address any of the questions in the Q&A, and then afterwards we can go for closing. So back to you.
So one issue which I did not talk about, and one of the participants has raised, is the community engagement. Yeah, this is a very, very important area, and I think we need to learn a lot on how to effectively do community engagement. Community engagement was, I would say, not great to start with in the COVID pandemic as well. But over the period of time, as we understood more about the virus, how it is transmitted, what precautions and interventions can help, some of the countries did very well on that. And those countries also did not have many casualties during COVID. But AMR, I think this space still is not very well done, and we need to be doing more community engagement in terms of physicians, engaging with the physicians as well as community about the threats of antimicrobial resistance. And I have worked in HIV for many years, and I know that how much effort and work went into drafting messaging and communication for HIV. I think similar kind of a focus needs to be brought into AMR as well. Only then we will be able to explain to community what is the perils of improper use of antibiotics. Because right now nobody understands this. It is something like climate change. Today you talk to some people about climate change, talk about carbon footprint. Nobody understands the kind of impact it is going to have in our future. Similar is the situation with antimicrobials, and I think we have to be more communicative, and we have to find ways to make communities and physicians understand about the threat.
I find that one of the questions about the public engagement, and it is lethal engagement. I face this with my own, because I'm sharing in public engagement and public campaign since 2016. So what is the most important lesson is to keep engaging the public, using different way of communicating with public, either in talks, when you're speaking with the families. I have this experience when speaking with the families and the children of the families, are speaking in the very simple language. Use plain language, use graphics and figures, use storytelling, because public need to listen to stories. So try to engage the public with any attracting elements, and keep it simple and translate it according to the language of the public. But keep going, because maybe it doesn't has impact on what you are seeing now, but for consistent work, it's really helpful. Another question is about the importance of antibiotic stewardship to prevent antimicrobial resistance. This is the story from, or balancing the story between the antibiotic stewardship and the antibiotic resistance, because the common in this is the antibiotics. So we are using the antibiotic. If the patient has any resistance, or if we are using the antibiotic without anything, according to our need, without any restricting, without any guidelines. So if we have patient and we give this patient the broad spectrum antibiotic, patient at this moment don't need the antibiotic, but now we educate the bacteria how to become resistant. And by the time, if this patient have serious infection, and I see it of many of the cases in the intensive care, I see the patient has now the resistant bacteria, and I see the bacteria is severely go to sepsis, go to escalating, because we could not be able to treat antibiotic. There is no broad spectrum antibiotic reserved or protected to this bacteria. So what's all the aim of the antibiotic stewardship is to optimize the antibiotic use, make like arrangement of antibiotic use, like the WHO aware classification to classify the antibiotic and reserve the broad spectrum antibiotic to the patient who need it. For this reason, it is important if we reserve the antibiotic, use it the antibiotic carefully and appropriately, then we reserve the broad spectrum antibiotic. If we provide access in the low and middle income countries to the antibiotic and provide access for this antibiotic, we need to educate the health professionals during the emergency or during any problem how to make systematic approach to prescribe this antibiotic by monitoring, by strategies, by the committee, by the champion who lead the antibiotic stewardship practice. It's a big issue, but what is the most important answer for this? That's antimicrobial stewardship. If used properly, sustainable, and resilient, we could be able really to decrease the resistance. And I have this from the practical experience. We could be able to decrease the risk of the broad spectrum, the multi-drug resistant or banned drug resistant bacteria. I hope this will answer the question.
Thank you, Dr. Kamini and Dr. Rasha. I think we're coming towards the end of this webinar, but we will then ensure as far as possible to refer to some of your questions and comments on the chat. We note the desire also for some certification of participation. We'll take that into consideration for our subsequent webinars as we've been doing different series. And then I'd just like to perhaps close with the key message of why it's so necessary to invest in antimicrobial stewardship now. I'll echo already what's been said, that these processes and frameworks need to be in place before we have situations of healthcare emergencies and crisis. And of course, we need international cooperation to make sure that there's that ability to make that happen with the resources, the funding, the technical knowledge, also with political will to make this a priority. And also, of course, to build together an understanding that this is a global problem. So as we know, pathogens that are emerging and spread can go around the world. So this is everyone's concern and everyone can take a role. And in terms of what can be built, there's been clear recommendations, both by our speakers and our panelists here today. There's many other tools that you can also refer to from WHO and other quadripartite agencies. Prioritization is essential in low and income country settings where there's limited resources, and a stepwise approach. So you can always build versus feeling perhaps overwhelmed with the range of things that need to be achieved, but it's a process and it's more of prioritizing and starting with different elements. Antimicrobial stewardship is a particular area and aspects, but also it is integrated, or it should be seen as integrated within National Action Plan actions, which are also multi-sectoral and should have linkages to other areas and disciplines, including, programs for tackling different infection disease areas, as well as with infection prevention control and water and sanitation and hygiene, as well as universal health coverage and other aspects. So this is an important agenda. We hope that's been useful to have this webinar to help some of these processes moving forward. Thank you so much, Dr. Kamini, again for joining us, and Rasha for thinking through the structure of this webinar, and we will have others to follow. And we'll be making available the recording together with the policy brief that's already available. And feel free to always contact us if you have any future suggestions for topics or for speakers for our next webinars. Thank you very much.